The topic of the tutorial is blood vessels and lymphatics of the neck, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads: Carotid Artery System, in which we will do in detail the common carotid artery with carotid body and carotid sinus, cervical part of internal carotid artery, external carotid artery, and all its branches. This will be followed by internal jugular vein, subclavian artery and all its branches, subclavian vein, and finally cervical lymph nodes, in which we will do both superficial and deep cervical lymph nodes. Common carotid arteries. Common carotid arteries is the beginning of the carotid artery system. This is the arch of aorta from which arises three branches. On the right is present the brachiocephalic trunk. From the middle arises the left common carotid artery, and from the extreme left arises the left subclavian artery. The brachiocephalic artery further divides into the right subclavian artery and the right common carotid arteries. So, the origin of right common carotid artery is from the brachiocephalic trunk, and it arises posterior to the right sternoclavicular joint. The left common carotid artery arises directly from the arch of aorta in the thorax, and then it passes superiorly behind the left sternoclavicular joint to enter the neck. The course and relations of the common carotid artery. Both the right and the left common carotid arteries ascend through the neck just lateral to trachea and esophagus. It is enclosed within the fascial compartment called the carotid sheath. As common carotid artery ascends through the neck, it does not give any branches. The termination of common carotid artery is at the upper border of the thyroid cartilage. At the upper border of thyroid cartilage, the common carotid artery terminates by dividing into its two terminal branches, that is, the external carotid artery and the internal carotid artery. Carotid sinus and carotid body. Carotid sinus is a dilatation present in the terminal part of the common carotid artery at its bifurcation, as well as in the beginning part of the internal carotid artery. This dilatation contains receptors that helps to monitor changes in the blood pressure. Carotid sinus is innervated by a branch of glossopharyngeal nerve, which is the ninth cranial nerve. Carotid body is a small, oval, reddish-brown structure present at the bifurcation of the common carotid artery. It is the accumulation of receptors which is responsible for detecting changes in the blood chemistry, especially the levels of oxygen. It is innervated by branches from both the glossopharyngeal nerve, which is the ninth cranial nerve, and the vagus nerve, which is the 10th cranial nerve. Internal carotid artery. This is the internal carotid artery. Internal carotid artery arises from the common carotid artery at the upper border of the thyroid cartilage. The extracranial course of the internal carotid artery. The internal carotid artery ascends in the neck towards the base of the skull, enclosed within the carotid sheath along with the internal jugular vein and the vagus nerve. As it ascends through the neck, it gives no branches. The termination of the extracranial course is when the internal carotid artery enters the carotid canal present in the petrous part of the temporal bone, after which it enters the cranial cavity. The internal carotid artery supplies the cerebral hemispheres, eyes, and the contents of the orbits along with areas of forehead. External carotid artery. This is the external carotid artery. External carotid artery is one of the two terminal branches of common carotid artery. Common carotid artery terminates at the upper border of the thyroid cartilage by dividing into external carotid artery and internal carotid artery. The external carotid artery, after arising from the common carotid artery, ascends in the neck. Then it passes deep to the posterior belly of digastric, and then it enters the parotid gland. In the parotid gland, it terminates by dividing into its two terminal branches, that is, superficial temporal and maxillary arteries. External carotid artery gives 8 branches. One medial branch, which ascends along with the external carotid artery and is known as ascending pharyngeal. 3 branches arises from its anterior border, and they are the superior thyroid, which is this, lingual, and facial. It gives 2 branches at its posterior border, and they are the occipital artery and the posterior auricular artery. Its 2 terminal branches include superficial temporal and maxillary arteries. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Ascending pharyngeal artery. This is the ascending pharyngeal artery. Ascending pharyngeal artery is the smallest branch of external carotid artery. It is the only branch of external carotid artery that arises from its medial surface. It arises close to the origin of external carotid artery. The course of ascending pharyngeal artery is that it ascends in the neck between the internal carotid artery and the pharynx. Area of supply of ascending pharyngeal artery is muscles of the pharynx, palate, tonsil, pharyngotympanic tube, and meninges in the posterior cranial fossa. Superior thyroid artery. This is the superior thyroid artery. The superior thyroid artery arises from the anterior border of the external carotid artery. It is the first branch from the anterior border of the external carotid artery and arises close to its origin. It passes downwards and forwards to reach the superior pole of the thyroid gland. The area of supply of superior thyroid artery is 1. It supplies the thyroid gland, and 2. It gives a branch called superior laryngeal artery which supplies the internal structures of the larynx. Lingual artery. This is the external carotid artery, and from its anterior surface arises the lingual artery. The lingual artery arises from the anterior surface of the external carotid artery above the origin of the superior thyroid artery, opposite the tip of the greater horn of the hyoid bone. The artery passes deep to the hypoglossal nerve and the hyoglossus muscle. The area of supply of lingual artery is tongue and the floor of the mouth. Facial artery. This is the facial artery. Facial artery is yet another artery that arises from the anterior surface of the external carotid artery. It arises from the anterior surface of the external carotid artery just above the lingual artery, above the tip of the greater horn of the hyoid bone. In its course, the artery passes deep to the posterior belly of digastric, then it continues between the submandibular salivary gland and the mandible. It emerges over the edge of the mandible just anterior to the masseter muscle and enters the face at the anteroinferior angle of the masseter. In the face, it follows a tortuous course to accommodate the movement of the mandible. The branches that the facial artery gives are divided into two: the artery that it gives in the neck and the branches that it gives in the face. The branches that it gives in the neck include the ascending palatine artery, which supplies the soft palate; tonsillar artery, which supplies the palatine tonsil; submental artery, which supplies the submental region of the neck; and glandular artery, which supplies the submandibular salivary gland. Branches that it gives in the face include the inferior labial artery for the lower lip; superior labial artery supplies the upper lip; lateral nasal supplies the nose; and the angular artery, which is the terminal branch of the facial artery, supplies the medial part of the eye. Occipital artery. This is occipital artery. Occipital artery arises from the external carotid artery opposite the area from where arises the facial artery. That is, facial artery arises from the anterior surface of the external carotid artery, and just at the same level, the occipital artery arises from the posterior surface of the external carotid artery. The occipital artery passes backwards and upwards deep to the posterior belly of digastric muscle and then emerges on the posterior aspect of the scalp. The area of supply of occipital artery is the posterior scalp, sternocleidomastoid muscle, meninges in the posterior cranial fossa, and the mastoid air cells. Posterior auricular artery. This is posterior auricular artery. Posterior auricular artery is a small branch of the external carotid artery arising from its posterior surface above the occipital artery. It passes backwards and upwards behind the ear. The area of supply of posterior auricular artery is scalp, posterior to the ear, parotid gland, external, middle, and inner ear structures. Superficial temporal artery. Superficial temporal artery arises from the external carotid artery in the substance of the parotid gland. Superficial temporal artery is one of the two terminal branches of the external carotid artery and appears like an upward continuation of the external carotid artery. This is the superficial temporal artery. The course of the superficial temporal artery is it passes anterior to the ear, crosses the zygomatic process, and above this point it divides into its anterior and posterior branches. The area of supply of superficial temporal artery is parotid gland and its duct, anterior part of the external ear, lateral part of the face, lateral aspect of the scalp, and temporal fossa. Maxillary artery. This is the maxillary artery. Maxillary artery is one of the two terminal branches of the external carotid artery. It arises from the external carotid artery within the parotid gland and is the larger of the two terminal branches. It arises from the external carotid artery behind the neck of the mandible. In its course, it passes medial to the neck of the mandible into the infratemporal fossa, and then from the infratemporal fossa, it passes through the pterygomaxillary fissure into the pterygopalatine fossa. Maxillary artery has a wide area of supply. Its area of supply includes external acoustic meatus, temporomandibular joint, dura mater on the lateral wall of the skull, mandibular teeth, skin on chin, structures in the infratemporal fossa, maxillary air sinus, upper teeth, infraorbital area, and skin below the eyes, palate, roof of pharynx, and nasal cavity. Maxillary artery in detail, with the name of all its branches and the area of supply of each of its branches, has been done in the chapter Infratemporal Fossa. Internal jugular vein. This is the internal jugular vein. Internal jugular vein begins here. It begins as a continuation of sigmoid sinus, which is a dural venous sinus. The initial part of the internal jugular vein is dilated, and that is called the superior bulb of internal jugular vein. It is in the superior bulb of the internal jugular vein that it receives the inferior petrosal sinus, which is its first tributary. The internal jugular vein or sigmoid sinus exit the cranial cavity by passing through jugular foramen. It passes through jugular foramen along with the 9th, 10th, and 11th cranial nerve to enter the neck, where it traverses in the carotid sheath. This is the internal jugular vein. This is the internal carotid artery, and this is the common carotid artery. Course and relation of the internal jugular vein. Internal jugular vein traverses in the neck enclosed in the carotid sheath along with the internal carotid artery and the common carotid artery. It is initially posterior to the internal carotid artery. Then it becomes lateral to it. Further down, The internal jugular vein remains lateral to the common carotid artery throughout the course. Between the common carotid artery and the internal carotid artery, medially, and the internal jugular vein laterally, traverses the vagus nerve, which is present between the two vessels slightly posterior to them. Termination of internal jugular vein. Internal jugular vein joins the subclavian vein to form the brachiocephalic vein. The formation of brachiocephalic vein occurs behind the sternoclavicular joint. Tributaries of internal jugular vein are inferior petrosal sinus, facial vein, lingual vein, pharyngeal vein, occipital vein, superior thyroid, and middle thyroid veins. Subclavian artery. This is the right subclavian artery and this is the left subclavian artery. These are the subclavian arteries. The right subclavian artery arises from the brachiocephalic trunk behind the right sternoclavicular joint. The left subclavian artery arises directly from the arch of aorta in the thorax. Parts of the subclavian artery. Both the right and the left subclavian arteries are divided into three parts by the anterior scalene muscle. This is the anterior scalene muscle. This is the first part of the subclavian artery. This is the second part and this is the third part of the subclavian artery. The first part of the subclavian artery is that part which lies medial to the anterior scalene muscle. It extends from the commencement of the subclavian artery till the medial border of the anterior scalene muscle. The second part is that part which lies behind or posterior to the anterior scalene muscle. And third part is the part which lies lateral to the anterior scalene muscle, that is from the lateral border of the anterior scalene muscle till the outer border of the first rib. Branches of the subclavian artery. Subclavian artery has four branches. All the four branches arise from the first part of subclavian artery. There are no branches from the second or the third part of the subclavian artery. The four branches of the subclavian artery are vertebral artery, which is the largest branch of the subclavian artery. The second is the thyrocervical trunk, which is this. This is the costocervical trunk. And this is the internal thoracic artery. The subclavian artery extends laterally till the outer border of the first rib. After that, it enters into the axilla and continues laterally as the axillary artery. Axillary artery is a continuation of subclavian artery. Vertebral artery. Vertebral artery is a large branch of the subclavian artery. Here this is the vertebral artery and this is the subclavian artery. In this visual, this is the subclavian artery and this is the vertebral artery. The vertebral artery, after arising from the first part of the subclavian artery, passes upwards. As it ascends, it passes through the foramen transversarium of the sixth cervical vertebra. Further, it ascends through the foramen transversarium of the fifth, fourth, third, second, and first cervical vertebra. On reaching the superior part of the first cervical vertebra, the artery turns medially and lies on the superior surface of the posterior arch of the first cervical vertebra. Thereafter it passes upwards to pass through the foramen magnum and enters the cranial cavity. In the cranial cavity, the vertebral artery of the right and the left side join to form the basilar artery. Thyrocervical trunk. This is the thyrocervical trunk. Thyrocervical trunk arises from the first part of the subclavian artery and divides into three branches: inferior thyroid artery, transverse cervical artery, and suprascapular artery. Costocervical artery. This is the costocervical artery. Costocervical artery arises on the left side from the first part of the subclavian artery, but on the right side it arises from the second part of subclavian artery. It divides into two branches, and they are the deep cervical artery and the supreme intercostal artery. Internal thoracic artery. This is the only branch of the subclavian artery that arises from its inferior border. This artery descends in the thorax and passes posterior to the clavicle to enter the thoracic cavity. Subclavian vein. This visual depicts the venous system, and subclavian vein has been marked in orange for demarcation. These are the subclavian veins. Here, these are the subclavian vein. Subclavian vein is a continuation of axillary vein. Axillary vein passes upwards and medially till the outer border of the first rib. After that, axillary vein becomes the subclavian vein. So, subclavian vein is a continuation of axillary vein at the lateral border of the first rib. The course and relations of the subclavian vein. In the posterior triangle, subclavian vein is present anterior and slightly inferior to the subclavian artery. This is the subclavian artery, and subclavian vein is anterior and inferior to it. Subclavian vein is also present anterior to the anterior scalene muscle, while the subclavian artery is posterior to it. Tributaries. External jugular vein is a tributary of subclavian vein. That is, external jugular vein drains into the subclavian vein. Anterior jugular vein, suprascapular vein, and transverse cervical vein may either directly drain into the subclavian vein, or they may drain into the external jugular vein and thus indirectly drain into the subclavian vein. Termination of the subclavian vein. Here is the termination of the subclavian vein. The subclavian vein is joined by the internal jugular vein on the right side to form right brachiocephalic vein, and on the left side also internal jugular vein joins the subclavian vein to form left brachiocephalic vein. The right brachiocephalic vein and the left brachiocephalic vein join each other to form the superior vena cava. Thoracic duct. This is thoracic duct, which is a major lymphatic channel in the human body. Thoracic duct begins in the abdomen as an upward continuation of cisterna chyli. Thoracic duct passes upwards in the thorax where it travels in the midline with a zygous vein on its right and thoracic aorta on its left. Anterior to it is present esophagus. After that, thoracic duct passes upwards in the neck, and there it terminates at the junction between the left internal jugular vein and the left subclavian vein. The point where the thoracic duct joins the venous system. The thoracic duct is joined by three other lymphatic channels, which terminate by draining into thoracic duct, and they are the left jugular trunk, which drains lymph from the left side of the head and neck, left subclavian trunk, which drains lymph from the left upper limb, and left bronchomediastinal trunk, which drains lymph from the left half of the thorax. Right lymphatic duct. This is the right lymphatic duct. Here, this is the right lymphatic duct. The right lymphatic duct, which is present on the right side of the body, is formed by joining of three lymphatic channels. The right jugular trunk, which drains lymph from the right side of the head and neck. Right subclavian trunk, which drains lymph from the right upper limb. And right bronchomediastinal trunk, which carries lymph from the right half of the thorax. All these three channels join to form the right lymphatic duct, which is a short duct or trunk that immediately terminates by draining into the venous system at the junction between the right internal jugular vein and the right subclavian vein. Superficial lymph nodes of the head. There are 5 groups of superficial lymph nodes that form a ring around the head. They are occipital lymph nodes, mastoid lymph nodes, also known as post-auricular lymph nodes, parotid lymph nodes or pre-auricular lymph nodes, submandibular lymph nodes, and submental lymph nodes. These 5 group of lymph nodes are responsible for lymphatic drainage from the face and the scalp. The pattern of drainage is similar to the area of distribution of the arteries near the location. Occipital group of lymph nodes are located near the attachment of trapezius muscle and is associated with the occipital artery. The lymphatic drainage into these lymph nodes is from the posterior part of the scalp and upper part of the neck. Mastoid group of lymph nodes are also known as post-auricular lymph nodes. These group of lymph nodes are present posterior to the ear near the attachment of sternocleidomastoid muscle. These lymph nodes are associated with posterior auricular artery and they drain lymphatics from the posterolateral half of the scalp. Parotid group of lymph nodes. These are the parotid group of lymph nodes, also known as preauricular lymph nodes, as they are located just in front of the ears. They are associated with the superficial temporal artery and receives lymphatics from the anterior surface of the auricle, from the anterolateral area of the scalp, from the upper half of the face, forehead, eyelids, and cheeks. Submandibular lymph nodes. These are the submandibular lymph nodes which are present close to the submandibular salivary gland, inferior to the body of the mandible. These lymph nodes are associated with the facial artery, and they receive lymphatic drainage from the areas along the path of the facial artery, which includes face, forehead, gingiva, teeth, and tongue. Submental lymph nodes. These are the submental lymph nodes which are present inferior and just behind the chin and receives lymphatic drainage from the lower lip, chin, floor of the mouth, tip of the tongue, and lower incisor teeth. The lymph from these lymph nodes will then pass into one of the following directions. From the occipital and the mastoid group of lymph nodes, the lymph will pass into the superficial cervical lymph nodes. Superficial cervical lymph nodes are present along the external jugular vein. The lymphatics from the parotid, submandibular, and submental lymph nodes will pass into the deep cervical lymph nodes. Deep cervical lymph nodes is present along the internal jugular vein. Superficial cervical lymph nodes. These are the superficial cervical lymph nodes which are present along the external jugular vein. These lymph nodes are present on the superficial surface of the sternocleidomastoid muscle. Superficial cervical lymph nodes receives lymphatics from the posterior surface of the scalp through the occipital lymph nodes and from the posterolateral surface of the scalp through the mastoid group of lymph nodes. Superficial cervical lymph nodes send lymphatic vessels in the direction of deep cervical lymph nodes which are present along the internal jugular vein. Deep cervical lymph nodes. These are the deep cervical lymph nodes, which is a chain of lymph nodes present along the internal jugular vein. Deep cervical lymph nodes is present deep to the sternocleidomastoid muscle. The intermediate tendon of omohyoid muscle crosses the internal jugular vein and divides the deep cervical lymph nodes present along the internal jugular vein into two groups. Those lymph nodes which are present above the intermediate tendon of omohyoid are called upper deep cervical group of lymph nodes, and those lymph nodes which are present below the omohyoid muscle are called lower deep cervical group of lymph nodes. Upper deep cervical group of lymph nodes, which are these, is also known as jugulo-digastric lymph nodes. It is present in the region where the posterior belly of digastric muscle crosses the internal jugular vein. These lymph nodes receives lymphatics from the tonsillar region. The lower deep cervical lymph nodes are also known as jugulo-omohyoid lymph nodes, which is present along the internal jugular vein below the omohyoid muscle. They receive lymphatics from the tongue. The deep cervical lymph nodes also receives lymphatics from the superficial cervical lymph nodes. From the deep cervical lymph nodes, the lymphatic vessels will go into the right and the left jugular trunks, and the right and the left jugular trunks will finally drain into the right lymphatic duct on the right side and thoracic duct on the left side. Clinical anatomy of cervical lymph nodes. Enlargement of the lymph nodes of the neck is known as cervical lymphadenopathy, and it is a common manifestation of disease process that occur in the head and neck. It is also a common manifestation of diffuse diseases of the body, which include lymphoma and certain type of viral infections such as glandular fever and HIV infection. Evaluation of cervical lymph nodes is extremely important in determining the nature and etiology of the disease process that produce the nodal enlargement. Examination of the lymph nodes themselves often gives clinicians a clue as to the nature of the pathological process. For example, if the lymph nodes are soft, tender, and inflamed, then it suggests an acute inflammatory process, most likely infection. Firm, nodular, large volume, rubbery lymph nodes often suggest a diagnosis of lymphoma. From the topic blood vessels and lymphatics of the neck, some of the questions that can be asked in the examinations include short notes on carotid sinus, carotid body, common carotid artery, internal carotid artery, the extracranial course, external carotid artery. All the branches of external carotid artery may be asked individually as a short note, that is, a short note on ascending pharyngeal artery, superior thyroid artery, facial artery, lingual artery, occipital artery, posterior auricular artery, superficial temporal artery, and maxillary artery. Facial artery and maxillary artery may also be asked as a long question. Some more short notes include subclavian artery, subclavian vein, vertebral artery, thyrocervical trunk, thoracic duct, right lymphatic duct, superficial cervical lymph nodes, deep cervical lymph nodes.